Perhaps with this question you can answer it from the perspective of not just the operation itself, how long it takes, but also the whole process. So from beginning, they come and see you, to they're discharged and you're happy and off they go and enjoy their lives.
Yeah, okay. So, I mean, some patients that only requires 3 visits.
3 visits.
Some patients it can take 5 visits.
Okay.
So the first visit is you've booked a consultation, you come and see your consultant and you have some scans. We put some drops in your eye to dilate your pupils, we examine you, and then we sit down and we spend 20 minutes talking through cataract, much of the stuff we've discussed today, but particularly focusing on whether or not we're going to do vision correction at the same time and what lens implant we're going to use and whether multifocal lens implant is a good idea for you. Then once that's decided and we've agreed, we give you an information pack to take away to continue to make sure you're fully informed. The next day we see you is the day of your surgery. And you, as I say, providing you don't have advanced or very bad cataracts in both eyes, we can do both eyes on the same day. The next time we see you is within a week of surgery, but that's on the condition that have examined you after the surgery on the day of the surgery and happy with the way the eyes look and happy that the wounds are sealed and there's no issues. We then see you within a week of the surgery and anywhere between 3 and 5 days. And by that stage, most of my patients are coming in and are describing incredible improvement in their vision. Occasionally, the focus of the eye isn't quite perfect or the vision hasn't fully recovered. And if that's the case, and if they're not hugely happy with their vision, we'll arrange another follow-up appointment to see whether this is something that will just take a little bit longer for the eyes to settle down, or whether there are any further treatments necessary to fine-tune the vision. And I think this is a very important point that we need to get across to patients, is that when we use multifocal lens implants, we have to be extremely accurate in terms of the focus that we achieve in the eye. And we get it absolutely spot on 98% of the time. But 2% of the time, 1 in 50 patients will need a fine-tuning procedure. Now, the fine-tuning procedure usually involves a very small amount of laser eye surgery just to improve either to sharpen the distance if it's not quite sharp enough, or to boost in reading vision if that's what the patient's underwhelmed with. Again, it's only 1 in 50 people and it's always included in the treatment cost. It's not something that then you're going to be penalised for. It's part of providing the care package and delivering what you agreed with the patient.
That's great. And I suppose it helps in part that you're also a laser eye surgeon who could also do that treatment.
And again, this is a slight area of controversy because anyone can put these lens implants in. Yeah. But not all surgeons have done specific training to understand the parameters that are required for patients to benefit from these lenses, patients to avoid them in, because there are certain patients who are not suitable for these lenses. And personally, I have seen patients who have had these lenses and I now have been asked to remove them from their eyes because they should never have had them in the first place, unfortunately. It's not common. Most patients are suitable, but it's beholden on us to recommend that patients don't have them if there are certain things that mean they shouldn't. If you'd like to know more about vision correction surgery, give us a call and get started on your vision correction assessment.